Hello everyone! Welcome again to my YouTube channel. It's me again, Alona, your lactation consultant and nurse educator today. Today, it's going to be a very important day sa lahat ng mga nagbubuntis dyan or buntis, sa lahat ng malapit ng mga anak, sa lahat ng may mga babies na ngayon, and you're thinking about some feeding tools na magagamit nyo in case lalabas kayo, in case babalik kayo sa work, in case may mga some medical complications na kind of affecting latching or breastfeeding, okay? You can use your own breast milk or you can use feeding supplement for your baby. Kahit anong gamitin yung supplemental feeding para sa baby nyo, or if you can use your breast milk, ituturo ko sa inyo different feeding tools ngayon sa araw na to. So, bear with me. So, if, let's say, may mga pasyente ako sa aming breastfeeding clinic na they have really problem with feeding their baby. Either the baby is too small, preterm, or the baby is just that hindi talaga kayang-kayang mag-latch na baby. So they want to find other ways on how to feed their baby other than the bottle, okay? Kasi ang pinaka-easiest way talaga sa mga nanay na papansin ko in any areas of feeding, pinaka-mabilis talaga nila other than breastfeeding is to turn into bottle feeding, okay? Bottle feeding is good. It's so easy. You get your bottle, put your milk, and you're there. But there are other tools, feeding tools, that some moms hesitate. Nagdadalawang isip kayo kung paano nyo gagamitin yon. And you don't realize na some feeding tools are also easier than the bottle feeding, okay? It depends again on how you feed the baby using these feeding tools, okay? Now, sa Western country, sa mga nanay na naging pasyente ko, when it comes to difficulty of latching or difficulty of breastfeeding, ang pinaka-easiest way talaga nilang ginagamit na kahit hindi pa sila nanganak, they already bring this one sa labor, sa room nila during labor, itong nipple shield. And if you haven't watched my video about how to use nipple shield, go back later and watch that video dahil napaka informative yung video na yan about nipple shield, okay? So, ito yung pinaka, para bang bago sila gumamit ng bottle, dito muna sila dumadaan sa nipple shield, okay? Kasi gusto talaga nila na to bond the baby, to make sure na may attachment talaga between mom and baby. So gusto talaga nila na before sila titira sa bottle, gagamitin muna nila nipple shield. Ang nipple shield, as I'm going to repeat again, I recommend this one to a really difficulty feeders. Sa mga preterm, especially sa mga preterm, kasi their muscle tone in their mouth, the orofacial part of their face is still totally kind of weak, underdeveloped, kaya nahihirapan silang mag-latch. So this is one of the best ways, ang nipple shield, that I introduce kung talagang wala ng other options other than the bottle. So yun yung nipple shield. Go back to my videos later and watch the full video about how to use it, okay? Now, another thing other than this bottle, kung gusto nyo talaga na hindi masisira yung breastfeeding regimen nyo, how the muscles of the baby's mouth is moving, you can do the spoon feeding. Now, dito sa spoon feeding, maraming natatakot na mga nanay na magamit. Number one, takot sila na parang ma-overfeed si baby or parang machuchok si baby dahil hindi sila makapag-control kung how much amount you can put into the baby's mouth. So, there's a technique on how to use this spoon feeding, okay? Now, I use this spoon feeding doon sa mga really picky infant na minsan talaga may time na hindi talaga dumidede, hindi talaga no matter gaano sila kagutom, they don't want to latch. So what I do in this, I use this one for normally mga days-old babies. Why? Kasi doon sa days-old babies, ang milk supply ng mom sometimes is still not so fast. So sometimes it still drops, lalo na mga first day, second day, or third day, until may mga 5 to 6 days, minsan dumadami na yung gatas. So this spoon feeding na ginagamit ko ito siya para bang kumbaga, appetizer ang tinatawag ko. May mga babies na once you give them a little taste of your milk, they taste it, yung parang mga tuta na, okay, so when you feed a baby, so let's say ito yung preterm baby ko. Tingnan naman ang galiit ng baby ko. So let's say ito yung preterm baby ko. Ang ginagawa ko, if I using this spoon feeding, I just put the tip, yung pinakadulo ng spoon, doon ilalagay ko siya, ipapatong ko siya sa lower lip ni baby. Okay? Ipatong mo lang. Okay? Don't put it in. Ipatong mo lang. So I patong it, and then tip it a little bit. Tip meaning, ituwad mo ng konti. So, nakokontrol mo yung flow ng spoon, from the spoon to the baby's mouth. Ang mali ng ibang mga healthcare providers na tinuturo sa mga nanay, pag itong spoon na to, buhos ka agad. No. What I do is, again, put your milk in there. You're teasing the baby to taste your milk para once the baby tastes your milk, may inganyo si baby mag-latch. So what I do, I put the milk in here, put the tip of the spoon into the baby's lower lip, at tip over a little bit, one at a time. Hintayin mo yung dila ni baby. So, hindi ba, pag nilagay mo siya sa tip, lower lip, lalabas yung dila ni baby, right? Kasi naamoy. Pag lumabas yung dila ni baby, just like a little puppy, maglalak na yan. Gaganon na yan, maglilik. So, pag naglilik na si baby, doon mo na lagyan ng konting drop. 1 drop, 1 second. 1 drop, 1 second. So, wag mong biglain. Kasi may mga baby na feeling like choking o yung iba gumaganon. So, make sure do a little amount at a time. Pag nakikita mong baby is already like licking, tasting your milk, then try to latch. Yun ang ginagawa kong trick on how I can help the baby to latch. So, yan yung sa spoon, right? Now, how about the cup? Itong cup, I also mentioned this one some of my breastfeeding video. But I'm going to repeat it today for my new viewers right now. Dito sa cup feeding, make sure na pag when you put amount of milk in here, wag niyo munang punuin. Maybe just put half muna. Because when you put half, it's easy for you to control na hindi nasasayang yung milk mo. Based on research, when you use cup feeding, mas marami pa yung natatapon from the baby's mouth when you're feeding the baby kaysa naiinom ni baby. So, it's very important na pag bumili kayo ng, ito binibigay nga lang ito sa mga pharmacies, itong med cup na to. So, it's very flexible, it's very soft. So, when you try to feed the baby, pwede mong i-squeeze siya, squeeze it to thinner, like this. And then just, again, the same way on how you did the spoon. The tip of the cup should be at the lower lip of the baby, and then tip it. Tuwad mo ng konti. And wait for the tongue na maglilik si baby from your mouth. So, one of the best ways talaga na, noong una na may mga babies ako in our breastfeeding clinic na talagang they hate to take the bottle. Ayaw nila ng bote. So, nanay is going back to work, don't know what to do, kasi the only way that the nanay can conveniently buy or use is the bote. Because again, it's one of the easiest feeding tool na substitute mo sa breastfeeding. However, pag yung caregiver mo or yaya mo or sino bang mag-aalaga sa baby mo habang wala ka, it's always good na turuan nyo sila. Let them watch this video so that they will know on how to feed the baby. Kasi look at this one. If you are using formula right now, and sometimes the baby doesn't want to take the bottle, lalo na pag nagtititing ang baby, minsan ang baby pag nagtititing talagang ayaw dumede. Because again, their gum is very sore. Sometimes, kahit gutom si baby, ayaw talaga. However, if you can use these tools na mapapakain nyo sa baby, kahit masakit yung gum ni baby, at least hindi kayo worried. Baby has something inside the tummy. Another thing that I use for my sensitive feeder babies is the small feeding tube. Ito'y napaka-cheap nyong bilhin sa pharmacy. Look at that. This is just a cold feeding tube. I think this is 0.5 French na size. Very, very tiny. And then itong feeding syringe, this one is 5 ml. This one is 10 ml. So if I were you, pag kung malalaki na yung baby nyo, let's say 6 months, may mga 50 ml nito eh. May mga 50 ml. Kung ang baby nyo ay talagang tigasin ng ulo, na ayaw talagang mag-bottle feed. So this is also one of the best ways on how you can feed your baby. So you can do without the tube. Pwedeng walang tube, okay? Pwedeng walang tube. Kasi ang purpose nitong tube na to, ginagamit ko to sa mga maliliit na babies again. Ang ginagawa ko, so I put the milk in here, either mommy's milk or formula. Nilagay ko ang milk dito. Then, yung tip nito, hold it in my finger here. Pinapasak ko yung finger ni mom, ni baby. So, baby is sucking mom's finger, right? Pag ganun. Tsaka, ipipress mo siya, tutulo ng konti, 1 drop at a time, 1 drop at a time, 1 drop at a time. So, feeling ni baby, di ba, every time you put your finger in the baby's mouth, minsan talaga sinasak ni baby, ito yung trick ko. Ito yung trick ko na ginagamit sa mga babies na talagang lazy feeders or babies who really refuse to latch or babies who doesn't like the bottle. Ito yung pinakamagandang, one of the best ways, the easiest way, at walang nasasayang. Because it's from the tube, right? Now, if you don't want this feeding tube, at meron ka lang syringe, pwede kang ihingi nito sa mga, I don't know kung pinamimigay ito dyan, sa mga health clinic, health center, ito'y nai-sterilize din ninyo, okay? Nai-sterilize din nyo ito. So, anyway, so if you just don't have the tube, ito lang syringe meron kayo. So, punuin nyo siya. So, position the baby, let's say, where's my baby? So, lagi talagang, if you're gonna be using spoon, cup, bottle, or syringe, always position the baby upright. Okay, upright para hindi na to choke si baby, hindi nag-aspirate si baby. So always make sure you have that. So what I do is ganun pa rin. So you can start from the corner if you want. Okay? There's two ways you can do. You can start from the corner of the mouth kasi ang tip nito is pointed, right? See? Pointed. So you can start from the side of the mouth or you can start from the middle. Kahit ano, depende. I would say kung medyo maliit ang baby, maybe days old or 1 month or 2 months, you can start from the side and then just take a drop at a time. A drop at a time. Itong feeding method na to, huwag kang magmamadali, okay? Doon sa feeding tools tinuro ko sa inyo, other than the Bote, huwag kayong magmamadali. Kailangan may patience kayo. Kailangan you do all your household chores first before you, what do you call this one? Before you do your feeding. Dahil matagal kayong, sometimes matagal, depende kung si baby energetic talaga na kumain. Okay, so again, you can start from the side. Ipa-focus ko na lang, okay? You can start from the side, okay? You can start from the side, 1 drop at a time, or you can start in the middle. So, again, when you start in the middle, kailangan yung tip ng syringe, the tip of the syringe should be on top of the lower lip. Huwag mong ipasok, okay? Huwag mong ipasok. Now, for babies na malalaki na, 5 months, 6 months, na matigitigas nga ang ulo, na ayaw magbote, you can do maybe farther from the lower lip, kasi malalaki na sila eh. Their swallowing reflex is well formed as compared to tiny babies na na ganito. So, those are the feeding tools that I would suggest. Dahil may mga nanay na nagme-message sa akin na ang hirap talagang i-train ng baby nila to the bote. So I would suggest start with those little feeding tools that I've mentioned to you. Another trick that I use, ito sinasabi ko sa inyo, okay, not all lactation consultants do the same tricks that what I do. As a lactation consultant, napapansin ko to, itong nipple na to, ang ginagawa ko nito, pinapasukan ko siya, nilalagyan ko siya ng milk. Okay? So, what I do is, di ba may buta siya, right? I close it first, in-squeeze ko siya. Nilalagyan ko siya ng konting amount of milk inside. Pahigain ko si baby. Or I hold the baby. Okay, let me say. So, I put milk in here, right? Then, baby's here. Ang ginagawa ko, pinapasip-sip ko si baby nitong nipple na ito. No bottle, but just the nipple. Let him suck doon sa amount na yun. Then, masasanay na yun si baby sa feeling of a nipple. So, I hope you learn something from these tricks, okay? There are so many ways on how you